Hi ladies, it's Elisa and I'm here with another update. I'm sorry that my last two videos were broken in half and disjointed, and I think even the second video cut off the end of it. I was having problems uploading because I guess I'm out of practice. And anyway, so that was the birth story. It was, not my ideal experience, but even just a couple days after filming that, I'm feeling better already about it. I think it's just because we're getting closer to bringing Sawyer home, I think. So, this update is, well, like, it's going to be kind of a postpartum update slash Sawyer update. So, after the whole birth and trauma and everything, my body actually bounced back relatively quickly. I was really surprised. My bleeding, and now, it'll be a month tomorrow that, Sawyer will be a month old tomorrow, and, my bleeding has stopped. I'm just having really, really light spotting occasionally. And that's been gone for, I haven't been bleeding for, weeks, 2 weeks probably. But I was tender, obviously. I'm still swollen down there, but surprisingly, I thought I would feel way worse. Nursing, well, I didn't really have a chance to nurse very many times. We did try to breastfeeding 2 or 3 times before Sawyer was before all of his breathing issues really started getting bad, while we were in the NICU. But they didn't really work out because he was so tired. He was just so sleepy. It was really hard to keep him awake. Nursing more than 5 minutes. He was comfortable. He was warm. He was cuddled up next to me, so he would just sleep. So it was hard to do that. But he does have a really good latch, and hopefully once his breathing issues are taken care of, we'll be able to go back to nursing, but we are not. The doctors aren't sure about that yet. But yeah, so my body's been doing great. I am a breast milk making champion, and that's still going really well. I'm still waking up every 3 hours to pump, and I'm bringing in not all of my milk because it would be way too much. I'm producing way more than he could possibly eat. But I am bringing in the milk to the NICU, the various NICUs that we've been at, and yeah, so that's how that's been working. I am now I was using the little hospital has these little tiny cylinders that you can hook right to your breast pump, and the milk goes right in there, and I've been filling up those for the hospital, but I actually did start getting just breast milk storage bags, and so I pump into the provided bottles that come with the Medela pump, and I'm using a hospital grade Medela pump for anyone who's curious, and I really like it. The hospital actually has at them a hospital grade Ameda pump, and so I actually have 2 sets of pumping suction cuppy things, and I'm sorry, I don't know what they are called. And so I use when I'm home, I use the Medela pump, and when I'm at the hospital and I have to pump there, then I use the Ameda pump there. And I just take the milk from those little bottles and I put them into breast milk storage bags, which is way more convenient space-wise for your freezer. So I'm storing some here, yeah, and bringing in some. I'm storing most of it here, actually. I don't have a deep freezer. I only have a regular freezer, but they said the freezer that we have in the garage, because we don't open it regularly, that works perfectly fine. But it's still, I'm only going to be able to store it for about 3 months. But hopefully Sawyer will be home and breastfeeding before that. So I'm not sure what I'll do with it then. Maybe donate it. I've been thinking about that because I'm such a good producer. It would be nice to be able to share that gift with other women and children. But anyway, so yeah, I'm feeling really great. I don't know if I think I mentioned, because Brian was holding one of my legs and my mothers were taking turns holding my other leg, my hip was Brian was being a little aggressive with that hip, pushing it back because he's focused on trying to get me through the contraction. So I had a little bit of a limp, actually a really bad limp for this past month. So it's just, I'm now getting back so I can almost walk normally now. But I think something with my nerve in my leg did get a little wonky because there's still some numbness in my foot. So that's why I'm not walking perfectly normal. But other than that, I'm feeling great. But on to more important and great news. Sawyer, he is not home. He has spent the entire month in the NICU. He started off at our local hospital and he was only there for that one night. And then he did get transferred to a local hospital that was about 25 minutes from our house. And he was there up until yesterday, so 2.5 weeks, almost 3 weeks. And then he got moved again to another hospital. While he was there, while he was at the last hospital in Walnut Creek, uh while he was there, he was started off on the cannula, which is just a little tube up your nose, and then he started struggling breathing more, so they thought that they would bump up his breathing support, so they put him on a CPAP. And for any of you guys who know, it's kind of like a goggle thing or prongs also, that's like pushes like steamed air into your lungs. It helps. So it's like a step above the cannula. And a lot of people use it when they have sleep apnea. They wear the full masks and stuff, adults anyway. And then that stopped working, and so about 2 weeks ago, I guess a week and a half ago, they put him on the breathing tube. So steadily his problems were getting worse. They weren't sure what they were, why it was a problem at first, and then he came down with a case of pneumonia. I'm not sure how he got pneumonia in the hospital, but it's just something that happens. He got pneumonia, and so that's what he's been mostly struggling with this past like week and a half, and why he had to be mostly put on the breathing tube, because he really was not getting enough oxygen with the CPAP. So then they were like, hey, he's on the lowest possible setting. He was basically doing room air. It's very complicated. Lots of medical things, more medical things that I'll ever want to know. Anyway, he was basically at the lowest settings of this breathing tube that he could possibly be at. So while he was in Walnut Creek, they tried to extubate him, to take out the tube, and to put him back on the CPAP, to try to work him back down to the CPAP, back down to the cannula, and then hopefully to go home. But when they took him out, he didn't even last, not even probably 15 minutes. And then he started really struggling for breath. And we were standing right there, and we were watching this whole thing, and he's turning purple, and his stats are dropping, and his heart rate's dropping, and it was just truly horrifying and terrifying to watch your son basically, dying of lack of oxygen while they're trying to emergency re-intubate him, stick another tube back down in his throat so that he can breathe. And while they were doing that, they said that they noticed a lot of extra tissue there in his throat, and it was really hard to re-intubate him. Not to mention he's awake and he's, struggling to breathe, and he's panicking, and I'm sitting there completely traumatized. But yeah, it was really scary to watch. So they said, you know what, this is important. We learned something from this experience. He's just not ready, and maybe there's something obstructing his airway. So we want him to be seen by this ear, nose, throat specialist. So the ENT. But that's not at that hospital. It's at actually an Oakland hospital. For those of you who are not in the Bay Area, those two places are about 35 minutes from each other, and Oakland's about 35 minutes from us. So a little bit farther than Walnut Creek, on a much worse highway. So the commute's a lot worse. But not that matters really. But he did get moved over there, relatively fast. So today he actually was seen by the ENT doctor, and it was very scary again, because they had to bring him. They wanted to extubate him, so take out the tube again, and they wanted to do it in an ER, because if there was going to be extra tissue, they wanted to just have the procedure to trim it and take it out. So it was just hard to see him. He was awake, and he was having a breakthrough from his morphine. He was it's kind of getting really immune to the morphine, because that's what happens with those kind of drugs. You just build up a tolerance, and he's a big baby, so Um, he was awake and looking around, and it was really hard to say goodbye to him while he was being rolled into the ER. You don't want that to be you don't want that for your child. But um, what they found basically when they were there, they said that they did take out the tube, and they put in a little scope and took pictures of his throat to see what was going on. And the good news is that they did not find extra tissue. They did find some swelling there, but the doctor was pretty positive that it was just swelling because of the actual tube, because they had a pretty wide tube in him. And so when they took him off there, and he said that he was moving air, but that he was still struggling a little, so they weren't fully comfortable leaving him off and then moving him back down to the CPAP. But he re-put in a tube, but he put in a smaller tube. So he thinks that that'll help the throat heal and get rid of some of that swelling. And also they're going to be putting him on steroids. And hopefully, I guess that's known to reduce that swelling as well. So that's great news in that he seemed very confident that it was just swelling and that we would be able to do this. I'm trying not to put too much stock in that, because we've been told this will work, so many times, and let's try this and let's try that. And our son has spent the last month in the NICU. So, it's hard. It's hard to remain positive. But we theoretically could be going home soon, or he could be going home soon, or coming home soon. So that's great. Beyond great. So, today's Friday, they were originally thinking they would give him steroid for a couple days and then maybe try to extubate him on Monday. But then another doctor came in and said, you know what, that's kind of far out. We're actually going to try to probably extubate him, give him the steroids as soon as possible, and then try to extubate him maybe Saturday or Sunday. Which is great, because then we'll know, they'll give it a good college try and see how much he's struggling, see if that swelling has reduced. And hopefully, that we can make that step down to the CPAP, and then hopefully a few days later move a step down to the cannula and then home. After they take him off the CPAP, if he off the tube and put him on the CPAP, if we can do that within the next few days, then he will be moved back to Walnut Creek, because the Oakland Hospital is a much more high-level NICU, and he won't be requiring that kind of care. So he'll be moved back to Walnut Creek to hopefully keep him on the CPAP for some time, I'm not sure exactly how long, and then move him down to the cannula, and then be discharged, hopefully, from Walnut Creek relatively soon, I'm hoping. Because, again, the heart specialist did say that although his heart issues are contributing somewhat to the his breathing issues, they're not something. If it weren't for the breathing issues, we would be home with him now, and they would just be keeping an eye on the heart and be planning for his heart surgery at 3 months. So he is going to have that no matter what. But during the echocardiogram that he had this morning, actually, the technician actually thinks that one of his holes, he's got a PDA and a VSD. I don't remember what those words stand for, or what those initials stand for, but his PDA might be closing, which is common. But we haven't heard officially from the doctor yet if he really feels that it's closing. But either way, the doctor is the doctor originally said that he's pretty confident that he's going to have that surgery, because it is putting that extra pressure on his lungs. I guess your heart is one chamber, one big muscle, when the baby's inside of you, and it's working as one thing, I guess, to vaguely talk about what I understand it is. And because there's water in the lungs at that time, it's working one way. But when the baby's born, it starts kind of going like this and sending blood to the lungs and then out of the lungs, or something like that. And the baby's heart is working now such that because he has that little hole, it's sending just a little bit too much fluid into the lungs and not taking enough of it out. So that's how I understand his heart problems. So he needs to get those little holes sewed right up, because sometimes they close on their own, but his are not looking like they're closing on their own at this point, except for that tech that said today that he thought that one of them might be closing a little. But I mean, you know, it was a tech, one, but two, I just, you know, that's not enough to prevent him from having the surgery. So we're so close. I mean, we haven't ever been this close before. So we're careening towards bringing him home, I hope. But if they try to extubate him again and the steroids are not, you know, helping him breathe or move his oxygen, and that swelling's not going down, I really don't know what the next step is at this point. The doctors haven't even explained it to us, so I think we will cross that bridge when we come to it. Mostly the doctors are saying, well, you know, if that doesn't work, then it's just the baby's going to need time. The ENT doctor was sure that it just looks like the baby's going to need time. Sawyer just needs time to get that swelling down. And part of the reason that the swelling is there is because there's a tube. And because he's still trying to fight off that pneumonia, and, or, you know, he's no longer, he's been treated for the pneumonia, but the side effects of the pneumonia are still there, I guess. You know, he's still coughing up the phlegm and stuff, or he isn't coughing it up. They have to manually suction it out through his breathing tube. But, you know, we're the closest we've been so far. So hopefully he will be home soon. But I will keep you guys updated. When I know something, I will try to update you. And yeah, so that's that. And I'm going to compile a video of a whole bunch of pictures and stuff so that you guys can see him. And I will post that hopefully soon. Spending now, because they do have a sleep chair available in the Oakland hospital, because they're in individual rooms now, not one big room with a whole bunch of like babies. They're in individual rooms with individual layouts, the little bassinet bed things, and but it's really just not conducive for parents staying there. So although I had packed and fully intended on staying there, once we saw the facility, I was like, it's just not possible. It was just basically a rubber lazy boy that that the legs kick up, and you could stay there. They allow the parents, one parent, to sleep bedside if they want, but it's just they don't really make it easy for the parents to do that. Whereas at Walnut Creek, at least, they would provide boarding rooms like on different floors, like just empty patient rooms that you could stay in. And it's great that you could sleep with the baby, and, you know, some moms might, and I hope you guys don't criticize me for not doing it, but I just decided that me and Brian talked about it, and, you know, it's just better for me to be at home, and then we go visit, and it's really hard leaving him every single time I cry. But it's not conducive for me being there. It's not conducive for me pumping. It's not conducive to my sleep. It's not conducive to my health generally to be sitting up basically in what's basically a cushioned rocking chair to sleep. But hopefully he's not going to be there for very long. So that's what we're hoping for. But the nurses there seem really nice. So, you know, we're just he's not there for very long, and then we can go either back to Walnut Creek or just home. So if everyone could just hope and pray that Sawyer starts kicking ass with his breathing soon, then that'd be great. But that's it for now. Update with me. I'm doing good. I've lost, now that all the swelling's gone, and that the baby is no longer inside of me, I've actually lost just over 20 pounds. So, because if you guys remember, I did not gain a single pound in my pregnancy. It went up to about 3 pounds and then went back down again by the time I had given birth. And now I'm actually, you know, 20 pounds lighter than I was when I got pregnant. So I'm actually in all of my skinny jeans and stuff. So, that's one bonus. And I guess nursing, is just, I'm hungry all the time, but, I'm not gaining any weight. I'm just losing weight. So that's great. And Sawyer's a little rock star, and he's trying so hard. So I will be talking to you ladies, and thanks for sticking with me through this crazy, crazy journey. It's going to be a ride. So I hope you guys stay with me. All right. Bye, guys.